Right now, I don't know that we are seeing sufficient monitoring of people. Most certainly, people who could benefit from opiates are not receiving prescriptions for various reasons, including fear of the prescriber of somehow being scrutinized for doing so. And at the same time, individuals are being prescribed who may be the worst candidates for opioid therapy.
In my world, in women's health and chronic pelvic pain, I don't think that it would hurt me all that much if opioids were not here, because we already know that they unfortunately don't help patients in the way we need them to. So I would be focused, without having opioids in the world, on more neuropathic medication treatment.
I think that possibly could bring the healthcare system to its knees when you consider 100 million people suffer every day with chronic unrelenting pain, and to not have the opioids as a tool in your toolbox would be a devastating blow. I do think, however, though, that practitioners today have to be equally well-versed at the therapeutics of pain management, which includes the use of non-opioids and adjuvant drugs, certainly.
I do travel quite a lot, and there are many countries where opiates are not available for the treatment of any pain, actually, and I don't think that's a good thing. But the chronic pain patients do just fine because they don't expect to get opiates. They do other things, particularly in Asian countries where it's normal for older patients as they age to exercise more and to do more Tai Chi and to do more meditation, relaxation. That's how they expect to treat their pain.
Well, in a world in which opioids did not exist, I think that we would see more people worse off than better. I think that we can say in some settings, we've seen this experiment. There have been and still are countries in which opioid access is very poor or severely restricted and overmanaged. What you see in those countries is really a lack of good pain management.
We need opioids. The solution is not to get rid of the opioids. The solution is to teach the people in training how to use them, how to assess patients, how to determine who's an appropriate candidate for them, and to know how to monitor them along the course of therapy.
You know, I was there before we used opioids to any extent, and I actually was one of the people that thought that we needed to really consider how to use these with people with non-malignant pain. And the suicide rates were incredible in the field. People gave up, they felt overwhelmed. We offered them very little. Opioids were a miracle and always have been. I think a world without them would be devastating for the people who live with persistent pain, and there are quite a few of them.
I think society has to come to grips with the realities that drugs are misused, and the balance between a therapeutic agent and a poison is often dose, as has been said many, many years ago. All things are poison. It's only a matter of dose that determines whether they're therapeutic or not. And I think we have to struggle to bring the balance in the use of opioids back into appropriate context.